Good morning, everyone, and welcome to CSIS on this beautiful summer morning. I'm Steve Morrison. I'm Senior Vice President here at CSIS and direct our Global Health Policy Center work. We're really pleased to have you all here. We're very pleased for those who've come online to join us today. And we're especially honored to have with us here today EU Commissioner for Health and Food Safety, Dr. Vytenis Andriukaitis. He is a Lithuanian physician, a historian, co-author of Lithuania's Act of Independence and its national constitution in the period 1990-92, a party leader in the Social Democratic Party, a member of Parliament, a leader in Parliament, Minister of Health, and since 2014, EU Commissioner for Health and Food Safety. So a remarkable career spanning many disciplines and many settings, and he, in his role for the past 3 years, has been exceedingly active on matters of great importance on global health security in Europe, here in the United States, and globally. We'll be joined in the roundtable segment of our program also by Dr. Jean Patel, PhD, who is the science head in the Antimicrobial Resistance Strategy and Coordination Unit at CDC in Atlanta. Thank you, Jean, for coming to be with us. And Jean is accompanied by Stephanie Gumbas, who is the Secretariat Lead for TATFAR, which we'll hear more about in a moment, working with Jean. We're delighted to be focusing here upon an issue of such import to health security, namely antimicrobial resistance. It's something that at home and abroad, in Europe, in countless countries, has risen in significance, power, the threat imagined and seen in hospitals and clinics in daily life, and the we'll hear more about, emerged as a very dominant consideration, certainly in U.S. policy. Just yesterday in the Senate, a dramatic hearing on health security. There's a very strong consensus when we look across all of the multitude of things that we've faced. Early May, we held here at CSIS a roundtable forum, the Munich Security Conference, that came to hold a series of meetings here in Washington, D.C., and that was focused on biodefense and bioterror. And it was a very high-level group, lots of European representation, lots of senior-level current administration, Trump administration, previous administration, other subject experts. And the most powerful conclusion that came out of that discussion, common scientific uncertainties. We'll hear more from the Commissioner around the debates about animal and plant health and resistance to humans. This cooperation has proven its value over the last several years. It's been ongoing now for over 8 years. It's helped strengthen transparency. It's set common standards, agreement upon common language, common protocols for sharing data, conducting surveillance and clinical trials, and identifying critical gaps in scientific knowledge, data, and policy. And I think most importantly, it's knit together the network of experts in U.S., Europe, Norway, Canada, in institutions, key institutions, simply to get to know one another and be in regular communication. All of these things are highly valuable and deserving of I'm going to invite the Commissioner to please come forward and share with us his presentation. So please join me in welcoming him.
Ladies and gentlemen, and I hope like-minded friends. Thank you, John, for your introductory remarks and kind words. I'm not sure I deserve them all. It is a great pleasure for me to be here to discuss with you a subject that has been preoccupying me for a while. One of the most important international health challenges and most difficult facing the world today, that of antimicrobial resistance. First of all, I would like to ask you to be patient with me. I am still learning English, as you know. I have started very late, so it is terribly difficult for me to be fluent, but I will try. So now you all wonder I am here to speak about AMR. Well, my principal role as European Commissioner with responsibility for health and food safety is to support 28 European Union member states towards achieving common objectives. But many of these, particularly in the field of health, are not confident within the borders of the European Union. It is clear that this is not only a European issue. Bacteria do not respect national borders or walls or oceans between the continents, and these antibiotic-resistant bacteria are projected to kill 10 million people a year. It's like ongoing silent tsunami. Furthermore, the long-term economic damage of AMR could be worse than the 2008 financial crisis. In the European Union alone, it is estimated that AMR annually cost 1.5 billion euros in additional healthcare expenses and productivity losses. The case of urgent action on the global scale is plain for all to see. Last year, I attended the United Nations General Assembly in New York, where a number of countries, including the United States, made the commitment to implement activities of the World WHO Global Action Plan on AMR. Since the adoption of this Global AMR Action Plan and the United Nations Declaration on AMR, many countries have made significant progress in tackling AMR, and these achievements should be recognized and applauded. This has been the case for the US and also the EU. In the EU, we take pride in the fact that the European Union banned the use of antibiotics for growth promotion in animal production as long as 2006. It will be good to send this message to the United States. It's very, very serious, very important message. I am a firm believer in this policy and would like to see its further adoption beyond the EU. An external evaluation of the action plan that we have launched back in 2011 highlighted considerable achievements in areas such as harmonized surveillance in food producing animals. However, it also concludes that greater efforts we needed to tackle AMR and in a more concerted manner. This explains my firm commitment to stepping up current efforts. At the end of this month, I will present, in concrete on 29th of June, I will present a new European Union One Health Action Plan. It will focus on 3 strategic pillars: making the EU a best practice region, boosting research and innovations, and shaping the global agenda. I hope that this plan will serve as a principal vehicle for the EU to contribute towards implementation of current global commitments, particularly those under the WHO Global Action Plan. Let me expand a little bit on international action under the 3rd pillar, that is shaping the global agenda. Indeed, the US and the EU share many interests on AMR, and there is already good collaboration at technical level within the Transatlantic Partnership on Antimicrobial Resistance, so-called TATFAR. A key guiding principle underpinning our EU action to fight AMR continues to be One Health approach, bringing together health, veterinary, and of course, including today, environmental sector, in a unified and coherent effort to tackle AMR. As diseases can spread between humans and animals, these 3 sectors are undoubtedly interconnected. And now, when you look at those 3 sectors, very difficult word is coordination. We know very well how it's easy to sign declarations, but when you see possibilities to coordinate, cooperate, collaborate, and encourage, then you see that nobody likes to be coordinated. And it is very important. Because from scientific point of view, we know very well. But how to move into practice? I also must mention climate change because it has an enormous influence on new infectious diseases outbreaks and can give rise to a range of illnesses in Europe, Asia, and also in the Americas that were never characteristic to this or other climate zone. This will definitely influence the need and the use of antibiotics. Ladies and gentlemen, colleagues, before we move on to your questions, let me stress that I am under no illusion as to the magnitude of the task ahead. I recognize that there is still finally, I want to stress that citizens have an important role to play in these multilateral efforts. Let me tell you about a little experiment my trainees have done on the occasion of the European Antibiotic Awareness Days. My trainees went to 3 pharmacies around the building where our office is in Brussels, in Berlaymont, and ask simple question. Antibiotics you sell a day. What they learned is the following. On average, these 3 pharmacies sell 41 packages a day. If we imagine that these trends are common, there are 5,000 pharmacies in Belgium. 5,000 times 41 is 205,000 packs a day. I have studied. So I'm sure I could ask to put it on my Twitter with a claim. Large study shows 41 packs of antibiotics are sold in Brussels per day. No. Okay, I assure you, I won't do this. As a medical doctor, this real study takes a bit more than visiting 3 pharmacies. And many people out there really need these drugs. Therefore, we should not stigmatize anyone, because it will be very dangerous. But what we are interested in is what all 3 pharmacies said. They said that they sell too much and way too often the prescriptions are inadequate. They also added that people tend to get angry if they don't get antibiotics prescriptions, and often it's a question of knowledge, education, and of course, awareness. Awareness. People do not know that antibiotics do not kill viruses. At least shows a lot of surveys show the same. Or that they are ineffective against colds, simply. This little experiment is just a snapshot illustration in its relative capacity, of course. That's why citizens matter. We need to change the perception of how antibiotics are used. Colleagues, ladies and gentlemen, I have come to Washington because I believe that the EU and the USA should reinforce ongoing joint efforts on AMR. I look forward to working in partnership with the United States to implement existing global commitments, achieving sustainable development goals, fighting climate change, and of course, drawing attention on global health security issues and introducing vaccination programs locally and globally. Clearly, we have much in common, and I look forward to continuing working towards our shared aim of defeating threats that AMR to health, resistant infections, and to keep our antimicrobials effective for now and for future generations. I hope we can have a good discussion on this topic now. Thanks a lot.
Thank you. Thank you all. And congratulations also. It's wonderful that you're here, that you're having the opportunity to see Scott Gottlieb, the new head of FDA. I think you've already had an opportunity to meet. You've had an opportunity to meet with some of our industry leadership. Many of the industry, much of the industry today really is transatlantic in nature. I mean, when you talk to Johnson & Johnson, or you talk to GSK, or you talk to many of the firms that have a deep footprint both here and in Europe, it's become, on the biotech side, it's really become a transatlantic phenomenon in the last 15 years. It's quite striking, every one of our interactions. And it's terrific that you're going to be meeting with Secretary Price, I believe, later today, in fact. So that's terrific. Jean Patel, thank you for coming from Atlanta to be with us today, along with Stephanie Gumbas. And we know that CDC has been very much seized with this whole question of the threat of an untreatable disease, or a set of untreatable diseases. This is something that Tom Frieden put a big spotlight on. It's one that's at the center of this whole question of cooperation between the United States and the EU. And CDC brings an exceptional set of expertise to this problem, unlike almost any other institution. So tell us a little bit about the role that you've played and CDC has played, and the perspective that you have on this.
Sure, I'm happy to. You know, I think that's the term we have to start using, is untreatable infections. And that wasn't, especially when we first started addressing the problem of antibiotic-resistant bacteria, that wasn't a term we used a lot. And we really thought that we would continue to have new drugs available and that we would never have to use this term untreatable infections, but we do. There are untreatable infections occurring, so we are seeing bacteria becoming resistant to one drug after another after another. The new drugs that are coming to market are going to be very useful, but they're all going to have their niche application. There's not any blockbuster drug coming that's going to treat all these resistant infections. And that's why we need to continue our focus on antibiotic resistance. For us, our international collaborations, especially through the Transatlantic Task Force on Antibiotic Resistance, has been incredibly helpful at propelling our domestic programs forward. This is primarily a technical collaboration. It's been going on since 2009. We've decided to extend the collaboration to 2020. And one of the reasons is because it's a peer-to-peer interaction on a technical level that really helps us make sure that we're taking advantage of innovative thoughts around the globe and implementing these programs domestically. There was a great conversation that happened yesterday between U.S. and EU experts, and now we've expanded to include Canada and Norway. And this discussion was about how to best measure antibiotic use in animals. And we all want to move toward getting more precise measurements, being able to measure antibiotics at the species level. This is important because if you don't have that kind of information, you won't be able to improve antibiotic use in these different populations. And so this is a transatlantic conversation that's occurring. And, you know, another advantage we've had from these collaborations is being able to take these kind of solutions that we develop on a domestic level and then scale them up into a global solution. We've been working on campaigns to improve antibiotic use. These began as US, EU efforts, and now we work with WHO, and there's a WHO-led campaign to improve antibiotic use around the world. And we're also working on solutions like these for communicating about new types of antimicrobial resistance. We don't want to wait until we see a peer review publication before we learn about the next type of resistance that we have to be able to detect in our own populations. We need to hear about it as soon as they're discovered. And this is something that the EU and the US has been working on. We've included Canada and Norway in this expansion, and now we're working with WHO to create a global solution. And it's really TATFAR folks that are leading that effort with WHO because we spent a lot of time thinking about how to best do this. And And I think, we're also spending a lot of time thinking about how to use some of the new innovations that are coming to market. We actually are seeing some drug development occurring, and a lot of that is happening because of new efforts to fund antibiotic drug development. There are new diagnostics coming to market. There have been prizes in both the EU and the U.S. that are really helping to spur innovation of new diagnostics, some of which I think are pretty exciting. And I think there are groups like these that can really help make sure that we use those resources most effectively when they come to market.
Thank you. The existence of TATFAR and the fact that it's been so active now for 8 years plus, and that it's expanded its reach to include Canada, Norway, now WHO. It's an interesting phenomenon. It's one that shows the deep common shared interests that are driving this forward, and the desire on the part of these parties to come to common standards, common language, to tackle some of these most difficult issues. It got off to a start with a big political embrace, right? It was President Obama, the Swedish Prime Minister, head of the EU in 2009, embracing this, putting it into the communique, and things moved forward. One question to both of you is, does a body like this become sustainable through its own momentum and proof of value? In other words, you have this range of experts, senior level experts, that are now in the habit of interacting face-to-face by regular telephone communication in different subgroups. They're publishing, they're putting out articles about innovative financing, they're putting out articles on many of these scientific issues. It's really become a forum that's generated new knowledge, it's pushed, it's reached out to industry in all sorts of different touch points. Does it need a continued renewal through high-level political boosts, or is it something that's sort of taken on its own life, proven its own value?
We need to guarantee crystal clear political will today globally is very important, very important. I am very happy that at G7 level, at G20 level, at G20 we have countries which cover mainly all globe, because from populational figures. But it means that we need to continue pressing on political level, because not only political ministers or prime ministers or presidents, of course parliaments, of course national parliaments, we can send message to all in our parliaments to understand situation, complexity of situation, because of course it is very, very multi-sectorial issue, and you have no chance to address any IMR if those in parliament who are dealing with industrial issues, with food safety issues, they are far from understanding about AMR. We need to show that United Nations Declaration is only first step. Political will today is very important.
Jean?
Political will is what determines what we do on a day-to-day basis and how we implement our programs on antibiotic resistance. And so my job at CDC is to be an implementer of these programs and make sure that they're getting done across CDC. And one of the reasons we can work on TATFAR activities is because these are embedded in our National Action Plan. And so I think this global coordination that's happening at WHO, at the UN General Assembly, seeps down into our national action plans and really drives the work that we do. So it's incredibly important to keep us focused.
Now, much of the pressure or the impetus for people to make this a priority comes from the perceived threat. It was British leadership that really drove this forward 8 or 9 years ago, and it was because they saw this unfolding in their hospitals and their clinics. They saw people dying without tools.
Of course.
And of course, here in the United States, I don't know what the current numbers are, but the number that's typically cited is 23,000 deaths per year of untreatable infections.
27,000 in the EU.
So these are real numbers, and these are every year in. year out, these are people dying with no tools to save their lives. And I think it remains very important to remind the citizens of Europe, Canada, Norway, the United States of this enduring threat. Do you see a change in terms of popular understanding of the magnitude of this problem? Do people understand this, and does that translate into changed habits in terms of overuse or wanting to see greater political commitment to try and fix this problem?
From my point of view, of course, we are in a way step by step to see changes in people understanding. But in different countries, picture is quite a very different one. Pressing from people's side to use antibiotics and on every day's level. Can you imagine? Please ask general practitioners and they tell you that it's very difficult to say, sorry, you please wait. Of course, they need to have a rapid diagnostic test, but saying, okay, it's not needed to use antibiotics. Please take responsibility and not to use. But the pressing is high, and then they have no chance not to address those people challenges, and they then follow situation. And on primary level, prescription of antibiotics, very sensitive topic. Practically very sensitive. Why? Because people are awareness, of course. And if you look at, sorry to say, very important issue, of course, from a medical point of view, gonorrhea is very resistant today. Gonorrhea is very resistant to antibiotics, yes?
Yes.
Why? Why? Of course, because it is, very delicate issue. A lot of people are using antibiotics without prescriptions, using internet and so on. Self-treatment is not consistent. And then you have a lot of problems around, okay? And today, such bacteria is so resistant. This creates a lot of new problems. Why? Because of people awareness, because people of inadequate self-treatment and possibilities to achieve antibiotics through internet and so on, so on. Situation is quite far from level of awareness.
Jean, what do you see in the United States?
Attitudinally
and knowledge.
I think we're making good progress educating the patient and helping them to understand that taking antibiotics can be dangerous, and that's what we need to do here. The problem in the rest of the world is much more complicated, because we have cases where patients can't get antibiotics when they need it, and then might have access to the wrong antibiotics when they do need a drug. I think another challenge we have in educating the public and making them aware is the contribution of the environment to the problem of antibiotic resistance. And one of our biggest challenges is just really understanding the role that the environment has on antibiotic resistance. So this is going to be a challenge not only for the general public, but also for policymakers. But we do know the environment contributes to this problem. I would say that this coordination is absolutely critical, but it's going to be a huge challenge, because we're bringing together partners who have never worked together before on this issue, and there are a lot of unanswered scientific questions that we need to address pretty quickly to make sure we're responsible stewards of the antibiotics out there.
Let me shift to sort of the higher level policy question of continuing this level of cooperation. Two things. One is the biggest issue dividing the U.S. and Europe in this area is really around animal and food use of antibiotics, in which the practices and the norms in the United States are fundamentally quite different from those of Europe. And that's, as you pointed out in your presentation, this is an area of continued debate. So that's one point. And a second is that here in the United States, we're in a period of that's mixed. On the one hand, we have clearly acknowledgement by the Trump administration, by members of Congress, by others, by industry itself, of the rising significance of health security, AMR a central component. Part of that, this threat of untreatable infections, and it's not unlike other problems that we face. Secretary Price, in his visits to Liberia, to the World Health Assembly, and some of his other public statements, been very forthright in saying that health security matters significantly. Steps that have been taken at the White House to continue a strong leadership role with very competent folks staffing it on biodefense and health security. On the other hand, there's a skepticism, a populist skepticism around alliances like the EU-U.S. And obviously climate change has become a very divisive issue. So it's a delicate environment for trying to navigate moving to this next phase, to have continued mutual buy-in at a high political level around this cooperation, and to make sure that this remarkable level of progress sort of continues to move forward. And I think that's, all of these problems are manageable in my own view. I don't think these are insuperable obstacles, but it's a reality that requires some care in navigating in this next period. So Vytenis, tell us what your strategy is for kind of beginning patiently to kind of renew and reaffirm the value of this cooperation.
Absolutely. It will be better to have small steps in a right direction than to pronounce very big goal, but do nothing. And my strategy is to create bridges, use opportunities, to discuss in those areas in which we have the same approach. And then if we have the same approach, we need to enforce our activities and move forward and see how to implement. Enforcement, implementation, of course, in those areas which we have no disputes. Okay, we need to re-establish our contacts, and I was very happy to be those 3 days here and to meet a lot of people, and that of course FDA, and today I will be very happy to discuss those issues once again with Secretary Tom Price. And of course it's time to understand and to show possibilities to them. Second, of course, it's exchange of practices. Of course, I know that use of antibiotics as growth promoters here is very sensitive. I don't know it's good or not, but consumers must say final say, labeling issues and so on. A lot of problems around such issues. But it will be good to show our practices in reality, how we address those issues, banning antibiotic as growth promoters, but achieving good results. Why? Because we started to enforce animal welfare standards, hygiene standards. And it helps us, to be more preventive. Okay, we'll have good opportunity to discuss about animal welfare issues. And of course, also Norway. Norway is a very important country. Can you imagine? Norway reduced use of antibiotics in fishery 95%, because they started to vaccinate, and they use vaccines, and they started to assess ecological issues of fishery, and then they achieved a lot of results today. Okay, it's good possibility to discuss once again, because the water is the same. Atlantic Ocean from Norway to the United States is the same ocean. We are not far from each other, sorry. You know very well that all things are united. And of course, it is shown possibility to open discussions once again to discuss. Of course, you mentioned climate change, divisions, but I think that we will see once again to show. Please explain your divisions. What is the reality? Can you present your real view on so-called divisions? Maybe we see possibilities to encourage you to change a little bit approach and to discuss. Open debates is much better, but we need to have those databases for cooperation, once again cooperation.
Thank you. I think that's a very wise point, that there's not going to be a systemic transformation in U.S. agriculture, whether it's farm animals or plant production overnight, but there's certainly an openness and a new debate unfolding now around the degree to which resistance is coming forward that has direct impacts or indirect impacts on human health. On the side of the U.S. government, and I think it's important to remind people that, you know, the budget for this, the budget at CDC for this set of issues on AMR is currently around $168 million. That's real money in terms of you can get a lot out of that in terms of the cooperation and scientific work that can be stimulated in this. In the FY18 budget, which Congress now will be deliberating on, there was a $26 million cut proposed, which in the overall picture is a signal of that's a 13 or 14% level. CDC overall is subject to, I think, about 18% proposed cuts, NIH about 18%. And this has stirred a big debate in Congress and in American society around the value of science, and there's been an overwhelming mobilization in favor of continuing with a very strong CDC, a very strong NIH, not do away with key institutions like the Fogarty International Center. So the debate is unfolding now as we look forward here, and I'm not a pessimist, frankly, about the prospects for continuity of strong U.S. leadership here. Tell us a little bit. I don't want to put you on the spot. I know we didn't invite you to come here and speak on behalf of CDC policy leadership, but tell us a little bit about how you see this.
Well, so the funds that we have for antibiotic resistance, the funds you cited, were new to us in 2016, and we really invested in building the infrastructure in the U.S. so that we would better be able to address the problem of antibiotic resistance. And we're building state-based laboratory capacity to improve our ability to detect resistance and to detect outbreaks and respond to outbreaks. And this goes along with epidemiological focus in each state to respond to the data that these laboratories are generating and to help healthcare institutions work across each other to try to prevent transmission from one healthcare facility to another. And this is a particular challenge in the United States where our healthcare is a little fragmented, but we really have come to appreciate that only when the healthcare facilities work together can you implement robust prevention programs. And so these are the kind of investments that we're making, and you know, we think these are absolutely critical to make sure that we can keep up with the problem of antibiotic resistance. Within this laboratory network, we're looking at innovations for new ways we can detect resistance to new drugs that come to market, so we can make sure that when people have untreatable infections, they might be able to get access to the newest drugs that are coming to market or might be available through compassionate care programs and find a way to treat these untreatable infections. So we're committed to maintaining this infrastructure and really investing our dollars wisely to make sure they're in place.
Vytenis, did you want to add anything?
We are the same line. Now, speaking of the European Center for Disease Control and Prevention, I know that you have very well ties between ECDC and your CDC, and of course, you are in a way to provide a lot of financial instruments in our innovative medicine initiative, speaking about new diagnostics, our devices, our strengthening our laboratories, our capacities, and of course also coordinating. We have a little bit better situation because our member states have quite systematic healthcare systems and networks. They're not so fragmented. It's for our strength is, and of course also they have quite good prepared our surveillance system with the laboratories and indications. It's very important time to discuss about methodologies, you know, to see how to how to present European Union practice and to show our achievements in those areas. And of course, I only repeat once again the same what was said.
Thank you. Let's open the floor and get some comments and questions. We have microphones, and why don't we start over on this side? We'll get 4 or 5 folks. Please, start right here. Please identify yourself and be very succinct, single comment or question.
Yes, thank you very much. This is a great panel. My name is Claire Wingfield. I'm with PATH. I wanted to just hear you talk a little bit about the broadening scope of AMR. I feel like a lot of AMR has become synonymous with antibiotic resistance, but there are a lot of other microbes out there that we need to be worried about, like malaria and HIV. And how do you see those other pathogens? How do they play into the approach of AMR strategy?
Thank you. Right next to you.
Piggybacking on that, I'm Raylyn Campbell with Panorama. Wanted to ask specifically about TB as one of the drivers of AMR, and ask the question of how do we really conquer AMR without addressing TB? And the other 5 letters I would introduce to that is BRICS. I think it's very commendable that you're working across the Atlantic Ocean, but given that the high burden countries for TB and these other pathogens are in the BRICS countries, and Africa, where the big red dot, or the green dot and the red dots cover, how do you address that? How do you address this problem and challenge without bringing those actors into the conversation?
We had over here, Matt, and right here. Yes?
Hi, my name is Annalise. I'm a public health student at GW. And antimicrobial resistance wasn't really much on my radar until I came to GW. So I was wondering what things are being done to impact the curriculum at maybe the university level, undergraduate level, high schools, middle schools, elementary schools, and to teach children from the beginning to change their behavior instead of waiting until they're adults.
Thank you. Right here in the row in front here.
Thank you. I'm Cordelia, and I'm with the Washington Ireland program, and I've worked in hospitals in the UK, and I've seen the dangers of superbugs. My question is, if there's such huge fluctuations within antibiotic use in the EU, and has your department figured out why that is? Is it policy in member states? Is it cultural, or is it educational? Because if we're going to go for a One Health approach, we need to figure out why we have 28 different healthcare approaches.
Okay. Right here. We'll take one more, and then we'll come back to it, and we'll do one more round. Yes? You, please.
Ricky Matsumoto, GW as well. Commissioner, you mentioned how there's a lot of self-treatment on the internet. Do you think part of the responsibility lies with websites offering such information to also talk about the issues of AMR so visitors know about the dangers of it and self-treatment?
Thank you. Why don't we start with Dr. Andriukaitis. There was a direct question around how do you deal with the huge variation across 28 member countries, and then some of the other issues around curriculum, around tuberculosis, malaria, HIV, and internet. So,
first of all, I would like to draw your attention that 28 member states, they have different healthcare systems, but it doesn't matter. They have also a lot of common, And our asset is to have such different systems and show example of very good cooperation. Can you imagine? You have 28 different, and they are cooperating. We have a health security committee in which we are cooperating on all topics every day. We have rapid alert system mechanism and triggering if something will happen. We know we are mobilizing all member states because we have cross-border healthcare threats directive on the ground. And such directive was implemented in every 28 member states, in every national law system and national institutional system, and in their healthcare establishments. Of course, it helps us to use, of course, IT tools and have brilliant IT platform in which we have possibilities to use. And today we established one next step, IT platform on one health platform called. All member states have right to send 2 people from veterinary and medicine sector, or from veterinary or environmental sector. It's up to member states to decide. And then they have possibilities to present their plenary session agenda, establish topics in which they will be more than happy to deal with those issues. Of course, they are waiting on our antimicrobial action plan because it will be incoherent. And it's a good example to see possibilities to cooperate, keeping in mind that the healthcare systems under Lisbon Treaty, they are, and the subsidiarity, they national competence. But national competence open doors to really good collaboration. It's a really good example. I know that you have 50 states, but it's the same. We are ready to show our possibilities how to work.
Now, on the question of schools and curricula, and the question of internet, how are these issues treated?
No doubts. First of all, I know that we need to send messages, that we need to see new curricula, new agenda, because the things are in changes, in ongoing changes, and we need to renew our educational system and encourage our educational sector to draw attention on possibilities to provide real information at very low level, because such practices to train for hygiene training, to wash your hands, and that helps to stop spread of infectious diseases, or to understand what does it mean by epidemia, what does it mean pandemia, how to educate people to use, how to educate children to follow hygiene standards and understand it. Of course, air condition, air quality at schools, of course, we have directive, we cover some minimum standards in all 28 member states, and then we are once again educating our children about environmental issues, about understanding of environmental standards. Of course, greening our economy, and then showing to our people, to our children, that it's a good opportunity to use IT tools, IT platforms, and IT also is play a big game to disseminate. And of course, we have every year European Awareness Days, in which we try to involve all levels, municipal levels, schools, and of course national parliaments, and we have very strong, very active European WHO European Bureau, which is really strong in this, good cooperation with us together, and it helps create some more or less more knowledgeable environment. But of course, it's not enough. It's not enough. And using IT tools, platform possibilities to connect our information, which is on ECDC website, and to connect with our information of our national centers we have them, and of course with schools, and to encourage young generation to use this information. Very important, because of, as you know, a hesitancy against vaccinations. Anti-vaccines movements, they are ongoing. And then you see a lot of problems. And when you see death, 29 children die from measles in Romania last year. Can you imagine? For 5,000 cases, it's really terrible. We have a goal to be measles free, but we are not yet there. And hesitancy is ongoing, and level of vaccination is going slowly down. Why? Because we need to understand awareness instrument, knowledge, education, and of course and trust in science is very big issue. Today, some argue that we are living in post-trust society. I don't believe it, because if you look at Galileo, and people were against Galileo discovery, Earth is coming around the sun, and people presented to him into Inquisition. You know, it was big conflict between public opinion and science. It is not today's issue, but we need to once again see possibilities to use modern tools to provide scientifically based information to our people.
You know, the debates we're having here on the vaccine issues, not that different, really. I mean, we've had this outbreak in Minnesota among the Somali population, where there was an active interconnection with Andrew Wakefield and his folks in the anti-vaccine community, and it's triggered a mobilization. We had outbreaks in Southern California a few years ago, changed the whole practices of the state legislature in terms of medical exemptions, non-medical exemptions. Now we see over 50,000 unvaccinated children in Texas, where the opposite phenomenon happened, where there's a loosening of the exemptions, and people are very afraid there. Tell us a bit about the questions on malaria, HIV, TB. How do these figure here? Yeah. And also I wanted to ask you, on the way that TATFAR operates, my understanding is that representatives of the member states of the EU have observer status. They are able to come when you have face-to-face meetings every other year. They are able to come and be observers and participate. That the EU member states have that privilege. That it's another way of connecting and trying to bring across a common understanding.
Sure. So, you know, all of these antimicrobial resistant threats are a concern. TB is a huge concern. The reason it's listed in the U.S. as a serious threat and not an urgent threat is because we have a robust program to prevent resistant TB from getting within our doors. But the problem that's growing internationally is getting so big that, you know, it's going to be very hard for us to keep it out. And addressing this problem overseas is just a tremendous problem, and it's one that CDC is very concerned about. We have an action plan that's specific to TB, but we need to make sure that we're able to implement that action plan. And then antimicrobial resistance in malaria is another significant concern. I think it's not one that's being ignored. Once again, it's less of a problem inside our borders, but outside our borders, it's a huge problem. And there are international programs to address issues like drug-resistant malaria, and these need attention and care as well. I would say about HIV, drug-resistant HIV is also a significant health threat. And many of the efforts to prevent drug-resistant TB are really around preventing infections. I think that's something that we can learn also in the antibiotic-resistant arena as well.
I want to just quickly mention, as a parochial advertisement, we have a paper coming out in July on tuberculosis with a special focus on MDR that Dr. Audrey Jackson has been the lead author on that, and we'll be doing a public event rollout around that as well. Is that correct? Not a public event. We're going to be rolling it out. You'll see it. You'll see the paper.
That's great.
We're at the hour. There were a couple people over here who wanted to weigh in. I want to give them the chance if we can just go a few minutes over here. If we could collect several comments from over here. Why don't we start down front here?
Sure. I'm Kyle.
Please be real fast, and we'll try and pull together 4 or 5 folks and then come back and close.
Yeah, Kyle Kenner from the Pew Trust. We haven't talked a lot about clinical decision making. I wonder what you favor in terms of modifying behavior among clinicians to promote antibiotic stewardship.
And right next to you. No, go ahead, please.
My name is Edna Callan, and I work for the World Bank Group, and I lead a project called Enabling the Business of Agriculture, and I look specifically at livestock issues. One of the areas we've looked at is basically seeing how veterinary medicinal products are regulated, basically the market authorization of them, the labeling aspect of them. And this year, we're going to be looking at how use is regulated, but we're going to be focusing specifically, most likely, on antibiotics. So, for example, we've been research, and we do this project globally. So we looked at the regulatory issues in 62 countries last year, and in 2018, we're going to look at it in 80 countries. We have countries from all over, and particularly we assessed the design of the regulatory regulatory framework. So my question for you is, how do you see regulations being used to tackle issues of antimicrobial resistance? I know in some countries the law says you're not allowed to include on the labels used for growth promotion for antibiotics for animal use.
Thank
so
you.
that's the question.
A couple people in the rear. Max, there's a woman in the second or third row, and just behind her. Yes, please.
Hi, my name is Amanda Quintana, and I'm with USAID. I just had a quick question, and wanted to know if antimicrobial resistance was on the global health security agenda with the CDC.
Thank you. And right behind you.
Hi, my name is Kobayashi from JICA, Japan International Cooperation Agency, implementing agency of Japan's official development assistance to developing countries. I wanted to ask whether, and if yes, how the cooperation framework between US and EU engage developing countries. Thank you.
Thank you. I apologize to those of you that we can't offer a chance to. I think we need to come back. We've got 4 issues on the table: clinical practices, regulations relative to livestock, whether this figures in the global health security agenda, and then the question of how this might tie together to Asian countries. Dr. Andriukaitis.
Very complex questions, you know. I can't imagine how to address those questions in a few minutes, especially speaking about regulations for livestock. You know, it's really, frankly speaking, globally, agreement and all standards regulating livestock issues at WTO level. Because European Union has much higher standards when speaking about livestock welfare issues, hygiene issues, and so on. From farm to fork concept is a very difficult one. But we have no chance to say that our standards must be applied to all around the globe. You know, then next organization is the World Animal Health Organization and Food and Agriculture Organization. Here you have a possibility to press and to once again to show our way. And as you know, it was adopted. Global animal welfare strategy was adopted because of EU was very active at global level, and then it was agreed that it is WTO standards, and WTO standards are applying around the globe to all countries which are members of WTO. You know. And then we see possibilities to provide our instruments and helping developing countries to go forward. We have better training for safer food program, which we apply to third countries. Of course, we're dealing with all issues which are with livestock regulation. In EU, we have very strong legislative level of regulations. You know, animal health, last version of animal health, it was really very strong, and we are obliged today to establish new animal welfare reference centers, also showing possibilities to worldwide that we are championing in area which is very closely related to IMR and so on. And of course, with third countries, the question was the same about how to encourage third countries to move in this. You know that we have EU-U.S., EU-China agreement speaking about food safety issues. It also covers problems related to hygiene standards and of course also antimicrobial resistance. We have bilateral agreements with third countries, with Brazil and so on, in which we have also very active the possibilities to provide our standards. We organized EU South American conference on IMR, and of course it was also about livestock regulation, about very sensitive topics.
Thank you. Jean, just a quick comment on clinical practice and on the global health security agenda.
Right. So in clinical practice, I think for clinicians, they need to be educated on the proper use of antibiotics, and then you really can improve use by measuring use. and making these data available. And I think people need to be able to benchmark their use against peers, and that can really drive improved use. And in global security agenda, AMR is a component of the global security agenda. We're working with a number of countries in Asia and in Africa on the topic, improving their antimicrobial resistance infrastructure. And I think for TATFAR, we have an opportunity to use some of our domestic technical solutions that might be applicable in other countries and help scale up our solutions by working with partners like WHO and Global Health Security Agenda to make sure all countries can take advantage of things that we found to work domestically.
Thank you. We've gotten to the end of the hour. This has been an exceptionally rich conversation. Very grateful to you, Dr. Andriukaitis, for coming and being with us. I hope you'll return again soon. We'll be doing lots of work on health security in the coming years, and these issues are not going to go away or be resolved overnight. Jean, thank you so much for coming and being with us today, and to all of you, thank you for being with us. Thank you very much.